Every leader has a strategy. Executing on that strategy is the challenge. If you want to learn how to effectively achieve what you've set out to accomplish, then this show is for you. Gain keen insights and listen in as leaders share their stories and challenges. SOAR Vision Group and the Baldrige Foundation welcome you to Leader Dialogue Radio.
Hello, everyone, and welcome to Leader Dialogue, brought to you by SOAR Vision Group and the Baldrige Foundation. I'm Duffy Dixon, and joining me is Ben Sawyer, the Chief Executive Officer of SOAR Vision Group. Ben has more than 30 years of executive leadership experience. He launched the SOAR Vision Group to help align people with purpose to achieve exceptional results. Next to him is Jennifer Strahan. She is the Chief Operating Officer of SOAR. Jennifer has partnered with more than 100 health systems and businesses across the U.S. to help them transform their strategic and administrative operations. We're very excited. Our guest this week is Dr. Alex Daneshmand. Did I say it right, Doctor?
Yes, you did. Thank you, Duffy.
Thank you so much for joining us. He is the Vice President for Quality and Patient Officer Safety at Lee Health. Now, that is in Southwest Florida. And, Doctor, I'm going to let you talk about what all you do, because you encompass several counties, but most interesting to me is the fact that you have quite an achievement record. You were an aerospace engineer, then you became a doctor, getting your MBA, and now you work in quality in this pretty big hospital realm. Tell us what Lee Health incorporates.
So before he gets started, I just want to point out
brag some more.
Well, I just want to point out to the listeners that he is an underachiever, right? I mean,
right.
Clearly he doesn't have enough time on his hands.
I was gonna say, let's make a list for him: cure cancer, world peace. Just if you could get on that, that'd be great.
So go ahead, Alex.
Oh, thank you, Duffy. Thank you, Ben. Thanks for inviting me, Jennifer and Ben, for this opportunity. Really, we are located at Southwest Florida here, Lee County. We are a large healthcare system that take care of serving not only our community, but 7 other communities surrounding us. And we are a safety net hospital, and what that means is that we take care of people that are unable to pay. So as you can imagine, this creates its own financial issues. We do not receive any help from the county or the state. We are really running our own finances, and we're trying to be sustainable in that. And our challenge has been always, how do we innovate and how do we keep this healthcare system afloat, not only for our community, but also for those members that depend on us, those patients that depend on us. So it's definitely challenging in this value-based healthcare environment, and I'm excited to be partnering with SOAR in this journey of innovating ourselves, transforming ourselves to be much more agile, proactive, predictive in the way we provide that care to our patients.
So, Alex, we also have a wonderful partner that we're all collaborating with, Danu Performance Solutions. Monica Ray is the CEO, and she's, I think, listening in, and she will be on the next week's radio show where we do the deep dive on this. So it's fun to hear you describe that, what the opportunity is, and to be collaborative partners in helping Lee Health make that happen. A couple questions, if you don't mind, Alex, that I want to kick off with. What, first of all, led you and Lee Health to pursue a performance excellence journey?
Well, great question, Ben. I think the biggest thing that made us think why we need a different model of management system and operating system was quick realization that healthcare around us are changing quickly. We are actually the largest healthcare provider here in Southwest Florida. We don't have any other necessarily a competition, but we realize that if the competition does come to our arena, that we need to have a fundamental understanding of what our business model is and how our decision flow and decision that brings deployment to an efficient way would look like. And So we reached out to both SOAR and Danu and said, we have heard about Baldrige. We have heard about performance excellence. Unfortunately, we don't have the patience for waiting 7 to 12 years in some cases to transform. So at that time, we kind of started talking about how do we transform the organization faster? How do we bring these changes quicker, where we can actually help our community really quicker and faster to be able to respond to some of those external changes that are happening. And that's where we started having this discussion, is that if we want to transform our organization, I don't think external forces will allow us to change it in 7 to 12 years. We need a much more expedited, faster change so we can keep up with these external forces and don't allow those forces to affect our trajectory.
And that's what we've learned with SOAR Vision Group. You have taken what the Baldrige Foundation does, and as you said, it can take years to really master this. And SOAR Vision Group has come along and made it much more applicable. People can get started a little quicker on it. It basically, how did they put it? You provided the framework that makes it easy to understand across multiple businesses.
Yeah, so actually, Alex, maybe you can, for the listeners, kind of define what the key ingredients of that accelerated journey on, and I'm specifically just thinking out loud of how Monica Ray and her partner Pat Lapicus kind of serve as the architects of the Baldrige Performance Excellence framework, helping to identify opportunities for improvement and so forth, and that Jennifer and I and the SOAR Vision Group are really helping as kind of the engineers and construction company, if you will, to be able to provide that strategy execution structure for accelerated results. So take it from there, Alex, and just kind of give us your sense of what are the key ingredients that you guys have identified for the accelerated journey.
Yeah, thanks, Ben. I think one of the things that we noticed right up front, that if we were just going purely with architect, and in that case Danu, to build this journey, that the journey will take us as long as everybody else. And plus we're a large healthcare system, so it may actually take us even longer than that. And we really did not have the patience or the chance to have to wait that long. So by bringing really SOAR to become the engineering group, and by us putting a core team around it and build our infrastructure, management infrastructure, to be at one level to be the steering council or the owner of it, and that's usually the C office, the C-suite office, and then the core team, which is the internal team from Lee Health, to kind of put this entire system of operation that Danu bring in as an architect and the engineers SOAR bringing in, that for us to make sure we keep an eye on it to be staying as integrated, not siloed. I think that's really the trick to kind of move this forward. So our success, I would say, has been kind of realizing that this journey, if you go this linear fashion, it will take for a long time. If we want to expedite it, we really need to build the infrastructure at the top, the C-suite, going to the category leadership. And on the ground level, you have to constantly be doing those improvements that you need to do, and then connected with the top of the structure, which is the C-suite and the operational, to make sure those barriers gets removed as we're building that structure. So we're actually building the structure not only at the top of the echelon that we're building, which is your C-suite and the category leadership, but we're also building it at the lower ground. So not only you getting data and results right away to help your system stay much more focused on what is important to do, instead of just purely work on what's our strategy execution, what's our communication execution, what's our leadership style. Those are all wonderful and they need to get done as a structural building. But when we actually have a real problem in our hand on the ground level, you can fine-tune those structure much faster with the example at hand, plus get result right away. So short-term result with the long-term patients to build a structure that is performance excellent.
So Alex, a couple of things that you mentioned that I just want to point out and kind of pull out for listeners is that one of the things I really like that you started off with is talking about how you guys recognize that if you don't have a lot of competitors, it's actually very difficult to kind of step back and say, why do we even need to change? So I love that you guys are looking at this very proactively to say, regardless of who's in our market, we need to look at what's right for our patients, what's right for our stakeholders involved in our community and others that have an impact on this. But also that gives you a lot of ability in terms of kind of looking at this journey. You've talked about really being agile. So even though you're large, how do you stay agile and kind of fight the good fight of what every hospital does with overcoming silos, keeping the connection between strategy and operations? So can you talk a little bit about what are some of the outcomes that you expect to come as a result of this transformational journey?
So absolutely, Jennifer, your point is right on about agility and being nimble in our market. We are a mammoth in our market right now, and if a competitor comes in and tries to set up shop, it will be difficult because of our overall cost of doing business to become that agile and nimble and compete at the same time. So my expectation as really the head of the quality and safety for our market here, for our patients here, it's really can we understand our business model with performance excellence better so our really market differentiation become very evident for our patients, that the patient choose us because we mean something, because we offer them certain value that no other competitor can come in our market and set up that same types of infrastructure. We have not thought about that in the healthcare on a regular basis. We've thought about more as a service oriented and providing service to the entire community, and some healthcare system have suffered as a result of the fact that a competitor comes in and then they don't really quite understand their service line. So I'm hoping that as we go through this journey, we make the decision-making flow easier, much more nimble, much more agile. And then we discover at the end what is our business differentiation, what do we do well, and do it the best we can for our patient. Mm-hmm. And that, based on that, we build an infrastructure where we become service excellent, not only in one or two, but in all the services that we provide here. We can decide what is really working and what is not working for us in this community for our patients.
So, Ben, how important is it that they're doing this now? Because you have said on a number of occasions, when you look at Apple, when you look at Ford, when you look at the biggies, back in the day, they were the only game in town, and you have said it takes a blink of an eye to have competitors all around you, and it's not good enough to be the great one at the top of the hill. You always have to be looking at who's right behind you, or who's next to you, or who is just about to leapfrog you.
That is planning on eating your lunch, right? So Alex has been alluding to this, and Alex, as I answer Duffy's question, let's just kind of do this interactively. So digital health and medical tourism and other sorts of outside influences are impacting every market, and Fort Myers and the Lee Health market as well. So the challenge is, which is what Alex was talking about, is if you have a cost structure and an inefficiency that does not allow you to be nimble and or have the resources to invest, you got a problem. So fundamentally, a health system has to be able to do what they already do much more efficiently and create both capacity and operational financial margin to then be able to invest in digital health strategies to be able to compete effectively with organizations like Amazon and Apple and so forth that are coming into their market and potentially cherry picking younger, healthier people that have more of an affinity for telemedicine and that sort of thing.
And then you're getting into value, right? Because I will look for good value in my medical care, just like I look for who's going to get me my package the quickest can I get what I want when I want it?
So I think that's actually a really important point, Duffy, to bring back to the patient. So we're talking about this from a business perspective, which is really important to not, I think we lose sight of that a lot of times, that hospitals really do have to run as a business.
They're a business, yeah.
Even though they're serving a community, they can't do that for free. Some people it might be for free, but someone's paying for it, right?
Right.
It's just the nature of it. However, how do we take that back to the patient, right? So when you're on this transformational journey, what does that mean for the patient? How does that translate into better care? How does that translate into more convenience and more access to care? So Alex, can you maybe talk a little bit about what are some of the results that you would expect as you guys get in this? And I know you're still kind of earlier on this journey, but what's going to be different, and what is it that's going to make the patient say, wow, speaking of value from Duffy's standpoint, what is it that's going to say that even if I have a competitor, Lee Health's where I want to go?
Right, exactly. And I think, Jennifer, you're exactly right on. I want the patients to look at us as the easy access place, as the place that they get the best care, and we don't have to compete with someone else, because we provide the best care possible. Mm-hmm. People don't go to Amazon because Amazon has the best product necessarily. They go to Amazon, and I have no doubt that there are better sites than that can sell you very similar to product and better product, and maybe at a higher value, at a higher cost. But they go to Amazon because if you swap to the right, you order it right away. Is the ease of the order. Right. Is the fact that you pay pretty much the same price as the other site, but you can get that item much faster. That ease, it gives a differentiation to the market, to Amazon people, that people choose them not because they necessarily have the best product, but the ease of use. What we would like to become here at Lee Health is that people choose us because we provide the best quality of care, the best value, and because we have an easy access for them to get it. So at the end of this process, if we can fine-tune our decision flow and our action to support what I just said, we are going to be successful. It doesn't matter who comes to this market. It will be very difficult for them to match the service, the quality, the care that we provide. I think in the past, the hospital system and healthcare system, they've piecemeal this journey. They have worked on patient experience, they have worked on quality separately, they have worked on their safety separately, and what happens as a result of that, you have a really siloed organization that things just don't flow, and patients don't come to our healthcare system by just getting quality or just getting safety or just getting patient experience. They come horizontally through our service line, not vertically. And this horizontal crossing that's where the healthcare system have struggled. And when you measure it as far as a patient experience, which holistically look at their entire experience from A to Z, we realize that, oh my God, we have a big trouble because we're not offering what customer needs or required. We're offering what we think the customer needs. Yeah. And I think that's where the Performance Excellence have allowed us to look at through all these silos and bring it as an integrated system going forward.
So, Alex, you're bringing up an interesting thing, and when you started off in the description of Amazon, I mean, one of the other reasons that people go there is you can get anything when you're there. Like, you're not having to go out and go to a different vendor and so forth. They sell everything.
And comparison shop, a lot of times they do have numerous products, and you can contrast and compare. Mm-hmm. But you're right. If you do the work, you may find a much better quality product.
Right, but so what's interesting is, Alex, when you started off on the description of Lee Health, it's comprehensive. You cover everything, and so that's great. That's a competitive advantage, but only if it's accessible. And I think that's the point you were just making is it's great if you have all those different accoutrements of the healthcare value equation for a consumer, for a patient. But if they can't access it, easily and simply, and also not just their front end access with care, but also the back end functions of billing and that sort of thing, then you don't have a competitive advantage. Go ahead.
I was just going to say, what a great point to point out in terms of the fact that when we think about this visit, and you even mentioned a holistic experience, Alex, and we forget, I think, that, the end isn't just when I leave the hospital, it's a bill that's coming later. And isn't that the worst taste that usually we leave in a patient's mouth, is like, oh, that's the worst thing. And that's what they look forward to the least, obviously.
Well, and particularly if it's inaccurate.
Yeah, and
that's
it's stressful,
the problem.
and you get another bill like a week later because, the physician fees were excluded from the actual consulting fees and from the facility fees, and it's a nightmare. And
Hey,
yet
you'll get
it's what
4
we do.
bills for one procedure,
Oh, yeah.
and you're really confused. Why is everyone billing me? Don't you guys talk?
Right.
Right. So two things to respond to, Alex. The first is, how does a health system like Lee Health take advantage of competitive advantage of the fact that you cover everything by basically being efficient? And then secondly, from a voice of the customer standpoint, how do you make sure that the entire customer experience is actually addressed?
Yeah, so I think we have an advantage because we have the market here currently. The question is, does the market have access to us on a regular basis? Or can a competitor come to our market and segment this market very quickly and realize that there are areas in this market that we're being like Kmart or Sears, and we are not able to compete with the agile and much faster and nimble system.
Right.
So we are definitely at risk for that. But that being said, our really competitive advantage on all of this is the fact that we still have the market. The market knows us. There is a name recognition. We are we have been in this market for a long time. We understand our market. However, are we reacting to those market the way the market wants us to react, or does somebody else bring a new shiny object and everybody's going to start going to that shiny objects much faster? So I think this is really our opportunities here to understand our customer, to understand our patients, and not assume what we've been here and we can do the job, but really kind of understand what their customer voice is and build the system that we have, the competitive advantage that we have, not based on the location or regionality, but build it based on the service that we can offer these customers of ours. And because we have the market, because we know the market, we have a better chance of innovating in this market and be able to provide what really a patient wants, not, for example, go back to Apple. Apple really improved on the iPhone of somebody else had made iPhone prior to Apple. What Apple did, brought the iPhone and said, we can do it better. And then as a result of that, they start getting market share coming to them. So we don't want somebody else to come to our market and say, look, we can do surgery better than the way healthcare, Lee Health can do this. And I think that would be our loss if we're not listening to the customer voice about what their needs are and how we can adjust to that needs to become better competitor.
That makes great sense, Alex. So a couple things as we move towards wrapping up this segment of the show. One is, what you've embarked on is complicated. It's multifaceted, and as a part of that journey, we had introduced up front a simplification tool, what we would call the organizational hierarchy of needs, that listeners to the show have heard over and over again. In fact, it's well detailed out on the leaderdialogue.com radio show, and dialogue is spelled DIALOGUE. So that website has that delineation. So wanted to ask you about how being able to have that level of focus and simplification to a very complicated operating system has helped. That's number one. And then the second question is, why has this change been mandatory? Why is it not optional? Because some of the listeners that are listening to this may be thinking, well, we've got time. Like, this has been going on for a long time. So it would be interesting to hear your perspective on why now.
So Ben, I think where I sit, and I think Duffy said in the beginning, my background has been in engineering, and I was a researcher at one time for United States Agriculture Department, and became a doctor and practiced as a physician for a long time. And throughout all of this journey, what I did constantly see is that the external forces on healthcare overall change and force healthcare to change every 3 to 5 years. Well, if we wait for those external forces to tell us what that trajectory is going to look like, we're going to be in a different place, and we may not even be able to compete. At that time, we may have to sell 1 or 2 of our hospital to be able to be much more nimble and smaller and so forth. Downsize. That's the word that a lot of the businesses are familiar with. What we are forcing ourselves to do is to evaluate our business model and operating model and say, the way we operate, can we survive in our business if there were multiple competitors in our market? That forces you to become not only highly reliable, but basically be preoccupation with failure of your system, but become highly efficient in the way you make the decision and deploy on those decisions to make things work. So I'm excited to be really partnering with this new way of thinking, because through what SOAR is bringing and Danu bringing to us, we're streamlining decision making process and information flow. And then obviously as a result of that, we're going to become much more nimble and agile in our market. So I'm excited, and I feel like if we don't do it, the market will force us to do it. And at that time, you have no idea what the outcome will look like, where we can control the outcome a little bit better at this point.
Yeah, so one of the words you said right there is a scary word that nobody wants to hear, which is downsize. But it's a
That's a doozy.
Yeah, it's one of those that as soon as someone hears it, it's like, it gets your attention for sure. But again, the thing I love about it is that you guys are thinking about this in a very proactive state, because you guys are in a great market. But it's also very clear that in the industry we're in today, you can't sit back and just take advantage of that, because you won't be at the top forever if you do that. And so just kind of circling that back to the hierarchy of needs, if you guys, especially for our listeners, if you think about it and you're looking at this, it's not just from the perspective of the organizations, from operational efficiencies and effectiveness. You're looking at colleague engagement, you're looking at customer value, you're looking at your financial performance, but all of that circles back to strategy execution, which means you have to have a very clear strategy, and then you have to recognize, how do we get from point A to point B on where our strategy is, and how do we do that in a way that keeps our employees engaged, our patients and customers engaged, and everything that we're doing it in the best way possible, so that we're anticipating things that are coming long before they ever even have the opportunity to come.
That's the way you want it to happen. And I love the idea that he wants it to be quicker rather than years and years and years. So it sounds like he's ahead of the game and even thinking about this before it becomes panic.
Yeah, so Alex, maybe you can take us home on this one, but as an engineer and then as a physician, clearly you have to be able to identify kind of the roadmap, right? And then be able to execute against that roadmap, no matter how complicated that is. So in kind of closing comments, talk to us just a little bit about the essence of that roadmap and what Lee Health is planning to do to be able to execute effectively on that.
So I think a roadmap is simple. I think we have set a goal of 2 to 3 years to achieve the infrastructure that we need to understand our business better, to become more agile, and to have a very nimble decision-making process where we can adjust to the road ahead. So as part of this, really with the help that, Ben, you're providing us on the ground level, we're working on the throughput on the ground level. We want to know what the experience is for the patient from the time they enter our facility or our offices to the time they actually receive that bill at home. That experience is a very horizontal experience, so we're trying to understand that and be able to really kind of go through every single portion of that experience and say, do we have an opportunity to improve? When we find out through going through that opportunity to improve on each of those sections, there is an area that we need to standardize vertically better, then that's when we take it into the agile, nimble system that we're building around our operating model to make that decision flow become much more nimble and much more faster in being made, instead of the bureaucracy really take over from the process that we're trying to improve. Excellent. So that's really the roadmap that we're following. I'm excited because I feel like we're going to get short-term results for an organization that may not have the patience to wait 7 years for this journey to give its fruit, that we're going to get the fruit almost right away by lowering our length of stay, by improving some of the pain points for our patient as they go through our organization. And then we're going to have a long-term sustainability model where we're building a system where it can make decisions much faster and in a much more linear way, where the front line drive that decision making much more easier than waiting for the C-suite to make that decision, and then the front line then is the receiving end. We want to really turn this upside down. We want the front line to feel powerful enough because the strategy is very clear, communication is very clear, and the operation is supporting that decision flow to be done at the front line. And then all we're doing at the leadership, at the C-suite, we're just removing those barriers and building some of those structures to support the frontline decision making to become agile. That's the only way we can become nimble.
Well, Alex, we need to wrap it up, and thank you so much for being on today. You really represent the kind of innovative leadership that is going to make healthcare relevant in the future and in this digital age. And we really applaud the Lee Health team for also taking on this level of a transformation journey. Obviously, Jennifer and I know I can speak for Monica and Pat as well, are really privileged and enjoying this collaborative effort.
And what a great thing that we get to watch as they do the work. We want to thank everyone for joining us on Leader Dialogue, brought to you, of course, by the SOAR Vision Group and the Baldrige Foundation. Remember, you can listen to a new live show every Friday at 1 o'clock Eastern Time. Visit Business Radio X, click on Gwinnett Studio, and you'll find our show. You can also listen anytime, in fact. Go to leaderdialogue.com/podcast. Now, on behalf of Ben Sawyer, Jennifer Strahan, and our producer, Trey, I'm Duffy Dixon. Join us next time, next week, on Leader Dialogue here on Business Radio X.